Lang para sa akin, simple lang naman yung issue yan eh. Hindi naman siguro tama na ang mga tigalabas, mga dayuhan, ang magsasabi sa atin kung sino iimbestigahan ng pulis natin, sinong aarestuhin ng pulis natin, sinong ikukulong ng pulis natin. Hindi naman siguro tama 'yon. Dapat Pilipino lang ang gumagawa niyan. May pulis naman tayo may NBI naman tayo, may DOJ tayo. We recognize that there are great financial burdens to cancer treatments. So to ease the hardship of cancer patients and provide equitable access to healthcare, we have also established the Cancer Assistance Fund, which will pay for the cost of cancer diagnostics and laboratories not covered by PhilHealth. So as we establish a more accessible, efficient, and responsive healthcare system, I urge all public and private stakeholders to support the Philippine Health Facility Development Plan and invest in building more health facilities similar to the HCCH. Rest assured that the government remains committed to nurturing an environment that upholds the total well-being of our people, of course, with the continued support of our private partners and investors in healthcare. Good morning. It is a very important day that we are here now in this cancer specialty hospital that has been put up by Ayala Health and their partners Varian here in the Philippines. Kung maalala ninyo, ito yung pinisinta sa atin nung nasa San Francisco tayo. Tungkol nga sa MOU tungkol dito. Nabuksan, they started 2 years ago in the middle of COVID. Pero ngayon natapos na. So it is a very important development because it shows how working together can produce such impressive results. And it is something that is very clearly needed because cancer is now the number 3 killer in the Philippines. And so you can see that the necessity of it is clear, and the response also has been something that we consider terribly important. So congratulations to all those who have been involved, both on the public sector side, the private sector side. Ito yung kagaya ng nasabi ko kanina, it is a very good example of how our cooperation on all different stakeholders, both in the private sector and in the public sector, and the professionals and ordinary citizens, can bring about such impressive results. So we hope to do it even more. All right? Yes.
Sir, kanina nabanggit niyo po yung may mga financial burden, yung po Cancer Assistance Fund.
Yes.
Can you tell us more about this, sir?
Well, we're still putting up the details together, especially how to fund it. But it is one of the main problems that we have been seeing. Although they've made some progress the technical progress in terms of the science, that the costs have been brought down. And I take note of the fact that AC Health has actually taken on the profit margin to keep the costs down. And I thank them all for that. And I think that the patients that will go through, that will be helped by this facility, will also be thanking them for that for many, many, many years to come. So these are the things that we are trying to do, so that the number one, the costs come down, and we can support what the insurance cannot cover. PhilHealth cannot cover all the medicines. Kahit yung private na insurance, hindi nila ma-cover lahat. So, kaya natin pinag-uusapan yung fund para yung malaki pa rin So yung hindi pa kaya na makover ng insurance, baka meron tayong magawa from the government side para maging naman mas magaang ang financial cost sa pasyente.
Sir, by the other issue, on ICC.
On?
ICC.
Oh, okay.
Sir,
I knew
sir,
this.
there's a resolution filed by some
Yes.
lawmakers
Yeah.
asking the government to cooperate with ICC para ma-push through daw yung probe. What do you think of this, sir? Would you
Well,
allow this?
this is not unusual, but it's really a sense of the House resolution. And it's the sense they're just expressing or manifesting the sense of the House that perhaps it's time to allow or to cooperate with the ICC investigations. But as I have always said, there are still some problems in terms of jurisdiction and sovereignty. Now, if we can solve those problems, then that would be something else. But medyo fundamental yung mga question na ganun eh. Because if you're talking about the sovereign jurisdiction of the ICC, especially since we have withdrawn from the Rome Statutes a few years back, that brings into question whether or not this is actually possible. There is also a question, should we return under the fold of the ICC? So that's again under study. So we'll just keep looking at it and see what our options are. Simple lang para sa akin, simple lang naman yung issue yan eh. Hindi naman siguro tama na ang mga tigalabas, mga dayuhan, ang magsasabi sa atin kung sino iimbestigahan ng pulis natin, sinong aarestuhin ng pulis natin, sinong ikukulong ng pulis natin. Hindi naman siguro tama 'yon. Dapat Pilipino lang ang gumagawa niyan. May pulis naman tayo eh, may NBI naman tayo, may DOJ tayo. Kaya nila yung trabahong 'yan. And that's really where the conflict is. Yeah. All right?
Mr. President,
Yes.
magandang umaga po. Sir, last year po naglabas kayo ng AO na nagbibigay ng 20,000 pesos na service recognition incentive para sa mga government employees.
Yes.
Will there be another SRI for this year para sa mga government employees?
We'll see how what is our financial position at the end of it, at the end of this all. Ganyan lang naman talaga yan eh. We wait until the end of the fiscal year to see what it is that we can afford. So we will have another look at that and to see that if it's possible. Marami tayong pinapagawa ngayon sa mga ano natin. So kailangan natin mag-compensate naman lahat ng mga Pilipino ngayon naghihirap. So kung ano yung maitulong natin, gagawin natin. So we'll see if it is actually viable, if it is financially feasible to do. All right, thank you.
Another question on health, pero on your health.
Yeah.
We heard that you were
My
feeling,
health?
yes sir, we heard that you were feeling under the weather yesterday. That's why you didn't attend the dinner reception.
I basically just ran out of steam yesterday. Hindi pa ako nakapag-recover sa biyahe. I suppose I just needed rest. I'm fine now. Thank you for your concern. No?